Children and adolescents frequently present in primary care with behavioral health needs. However, physicians are not well equipped to address those needs given the limited amount of time of their sessions as well as their limited training. Physicians then will refer families to an off-site mental health provider, yet many families do not make it to those visits, leaving the behavioral health needs unmet. There has been a move to integrate behavioral health services into the medical primary care setting to address behavioral health needs, and Monroe-Meyer Institute has been providing this integration since the late 1990s. This particular study was interested in demonstrating that youth and adolescents are accessing services earlier when issues are less severe. 6 pediatric primary care clinics participated in this study from urban and rural Nebraska. In these clinics, behavioral health providers were on site approximately 2 to 3 days per week, providing behavioral health services in a fee-for-service delivery model. Brief empirically supported treatments were utilized. Medical records for these behavioral health services were reviewed for approximately 600 initial behavioral health visits. The primary variable of interest for us was looking at referrals that came from on-site pediatricians versus those that were referred from off-site agencies, such as other primary care settings, schools, daycares, or even self-referrals. The primary variables of interest when making the comparisons by the referral source were how long were the presenting problem occurring, as well as the severity of it. And the length of the presenting problem was measured based upon parent report at the initial visit. In addition, the severity of the behavioral health problem was measured using the Achenbach Child Behavior Checklist that was completed by the parent or caregiver at the first visit. We were also interested in looking at how many visits were attended, what improvement was like over the course of those behavioral health visits, as well as what type of diagnoses were presenting. When comparing the on-site versus off-site referrals, there were no significant differences for the majority of the demographic variables. The exception would be that for off-site referrals, more males were presenting, whereas for on-site referrals, there was a higher level of private insurance, as well as more youth presenting with anxiety disorders. The average age for the youth presenting was around 9 years of age, ranging from anywhere as young as 1 up to 19 years of age. And the number one diagnosis for both samples were disruptive behavior disorders. When comparing the on-site versus off-site referrals, independent samples t-test revealed that the on-site referrals had received services when the presenting problem had been shorter in duration, as well as the T-scores being significantly lower than those referred from off-site referral sources. So this study appears to demonstrate that when behavioral health services are located on site with the pediatric office, that kids and adolescents are accessing services faster when problems are less severe. A particularly interesting point related to this study is that more children with anxiety disorders were accessing services in the co-located model. This is something to investigate further, given that we know that kids and adolescents with internalizing disorders frequently do not access services. And then finally, it is important to keep in mind that this was an applied study conducted with an authentic clinical data.